So we have a 23-year-old man presenting with right-sided abdominal pain with vomiting and the severe pain abdomen. The X-ray is given to us, and in this X-ray we can see there are two calcific densities which is present in the pelvis more towards the right side. Now it doesn't have classical central halo as that we see in case of the phlebolith. So first thing is we excluded the normal condition like phlebolith. Now with a calcific density presenting with the right sided pain or the right iliac fossa pain, we tend to think towards as appendicitis. Now when we think in terms of appendicitis, given the clinical scenario, we also should think that there might be perforation. There will be usually perforation, there will be usually mass formation by the appendix. So you should see for all these signs. So there is no free air, extraluminal air, which is not seen here. Also we have to look for, is there any increased density in the right iliac fossa which is pushing the bowel away from it. But even that is, bowel loops are pushed away from it. Now that is also not seen, but only the presence of calcific density in the X-ray, in the frontal X-ray of the abdomen, a plain X-ray of the abdomen. What we think, given the clinical scenario, is appendicitis. Now, what do I do next? Now, I would ask for an ultrasound. We have got an ultrasound report and we can see a blind ending tubular structure with a central hyperechoic area within, and which is causing shadowing posteriorly, which is causing shadowing. Now hyperdensity causing shadowing will more favors a stone than an air. Air also can cause appears hyperechoic, but it will not cause this posterior acoustic shadowing. So this whatever the hyperdensity that we are seeing here is favoring towards an appendicolith, and this blind ending structure, classical blind ending structure arising from the cecum, is usually suggestive of an appendix. So there is a appendicolith, there is an appendix which appears to be dilated, and when it is measured it is more than 7 mm. The combined wall thickness more than 7 mm suggests that there is an appendicitis or acute appendicitis. So this itself confirms that this is a patient of acute appendicitis. What is the next step? I will call a surgeon and ask for an appendicectomy immediately. But if we would have done a CT, what are the findings that we might have seen? Let's see that. So this is a CT that we are seeing. We can again see an hyperdense structure here, which is nothing but an appendicolith. Also we can see that the appendix is dilated and the wall is appearing hyper enhancing. Now here classically, if we see again, we can see the wall enhancing and there is a hyperdense structure. We can see the surrounding fat is appearing, the hyperdense, which is nothing but a fat stranding. So fat stranding is a classical sign that we see in any inflammation in the abdomen. So this is a case of acute appendicitis. We can see an appendicolith, we can see an inflamed appendix, and we can see fat stranding, a classical case of acute appendicitis. What are the things that we have to keep in mind whenever we see an appendicolith? Always see the central halo sign, which is seen in case of the phlebolith. Also we have to see in an ultrasound there should be more than 7 mm. The combined wall thickness should be more than 7 mm. Now what is the classical symptoms in an acute appendicitis? Now usually the pain starts in the periumbilical area and then it goes towards the right iliac fossa. This is a classical appearance, but one third of the patients do not present with the typical presentation. That's what we need to be known. Now, the clinically we know the pain starts in the periumbilical region, goes towards the right iliac fossa. If I do an X-ray, we might see a appendicolith. How to identify? It should not have this central halo. We see a calcific densities in the right iliac fossa. Now, once we suspect it, we go do an ultrasound which shows classical more than 7 thickness of the appendicular wall. Then what we do? We have to immediately do appendicectomy. If in case we get a blood investigation, if one blood investigation that we have to do, we have to do the WBC count. Now, always in 95% of the cases, the WBC count will be elevated. So these are the things that we have to keep in mind when we see get a case of acute appendicitis.